A 4-year-old boy is brought to clinic by his mother, who has noticed a small lesion in the external angle of the eye. On examination, there is a small cystic structure which is obviously been infected. On removal of the scab, there is the hair visible within the lesion. What is the most likely diagnosis? That means a 4-year-old boy who is very small child presents a lump which is present in the external angle of his eye, and it is a small cystic structure which is recently infected and hair visible within the tumor. That means there is a tumor, and in the tumor there is a hair follicle present, and this is the infected. What is the diagnosis? Here are the options. Options are dermoid cyst, desmoid cyst, sebaceous cyst, epidermoid cyst, and keratoacanthoma. So what is the diagnosis? First of all, see the different type of the cyst. First of all, which is the dermoid cyst. The cutaneous dermoid cyst may develop at the site of the embryonal. It is the embryonic development fusion. That means the area where is the embryonic development fusion, in this area it is usually the dermoid cyst present. And what is the most common site? It is the midline of the neck, external angle of the eye, posterior to pinna of the ear. So these are the most common site of the dermoid cyst. That means it is the midline of the neck, external angle of the eye, and the posterior part of the ear. They typically have multiple inclusions such as the hair follicle. So the dermoid cyst, as their embryonal line origin or embryonal development fusion, so they may present all type of the tissue, including the development from the epidermis, development from the dermis, and development from the ectoderm, develop from the endoderm, and develop from the mesoderm. That means this tumor also may contain different type of substances, including it may contain tooth, it may contain hair, it may contain bones, and such more. That means the tissue which is developed from the ectoderm, from mesoderm, and from endoderm. And this may also develop from the ovary, and the site are synonymous with the teratomas. So here we can see the dermoid cyst. This is the outer angle of the eye. Now the desmoid tumor, which is name is very close to dermoid tumor, but desmoid tumor is very different. The desmoid tumor is completely different from the dermoid tumor, and it is the low grade, and it is the fibrosarcomas or non-aggressive fibrous tumor, and this tumor arising from the fibrous tissue and muscle tissue. It is the musculoaponeurotic origin, and they commonly present at the large infiltrative mass, and that may be divided into abdominal, extra-abdominal, and intra-abdominal. Here we can see a desmoid tumor. It usually affects after the operation, and all types share the same biological feature. Abdominal desmoid usually arise from the musculoaponeurotic structure, that means from the muscle and from the fibrous tissue. Intra-abdominal desmoid tends to occur in the mesentery or pelvic side wall, and is commonly associated with the FAP, which is the familial adenomatous polyposis coli syndrome. That means the FAP. In case of the FAP, this desmoid tumor very common. And the dermoid cyst occurs at the site of the embryonic fusion. It is already read. They contain multiple cell type arising from the ectoderm, mesoderm, and endoderm. They occur most of the in case of the children, and the lesion is unlikely to be desmoid cyst. That means the dermoid cyst and desmoid cyst, they are totally different. Sebaceous cyst usually have a punctum. Almost all of the sebaceous cyst usually contain a punctum, and also they contain CG material, and epidermoid cyst contain keratin plug. So what is now our answer? Our answer is the dermoid cyst. Why? First of all, it is in case of the children. Second of all, it is the embryonic fusion line, which is the external angle of the eye, and also they are the hair present. Here we can see this is the hair present. So it is, answer is the dermoid cyst. The desmoid cyst is totally different, and it usually present in case of the FAP, which is the familial adenomatous polyposis coli. In case of the sebaceous cyst, usually punctum present or sebum material present within the cyst. And in case of the epidermoid cyst, there is keratin plaque present, and keratoacanthoma, they are different from this clinical feature.